Have you ever pondered the unseen connection between childhood trauma, personality disorders, and addiction? This intricate web of psychological factors is more entwined than you might think. Today we're setting off on a journey to explore this unseen connection, to unravel the threads that link these three components. First, we'll take a look at childhood trauma, an unfortunate experience that leaves indelible marks on the psyche. Then, we'll delve into personality disorders, conditions that can significantly affect one's interaction with the world. Lastly, we'll tackle addiction, a gripping and often misunderstood phenomenon. These three elements, though distinct in their nature, often converge to create a vicious cycle. They feed off each other, each one amplifying the other's effects. This intricate interplay is what we're here to understand. Now, let's delve deeper into the scientific link between these three components. Childhood trauma doesn't just leave emotional scars, it alters the architecture of the developing brain. Let's delve deeper into this. When a child experiences trauma, their brain releases a hormone called cortisol. It's the body's natural response to stress. However, chronic exposure to high levels of cortisol can cause the brain's structure and function to change. These changes can lead to problems with emotional regulation and stress coping mechanisms. For instance, the brain's amygdala, which is responsible for processing emotions and fear responses, can become overactive. This can result in heightened emotional responses and increased anxiety. On the other hand, the prefrontal cortex, the part of the brain that helps us think logically and control our impulses, can become underdeveloped. This can lead to impulsive behavior and difficulty in making sound decisions. Now, these brain changes can create a fertile ground for the development of personality disorders. These disorders are characterized by unhealthy patterns of thinking, functioning, and behaving. They are deeply ingrained and inflexible, often leading to significant impairment and distress. Imagine a brain that's already struggling with emotional regulation and impulse control. Add a personality disorder to the mix, and you can see how it becomes even more of a challenge for the individual to navigate life effectively. But there's more. These personality disorders can further increase the risk of addiction. Why? Well, addiction is often a maladaptive coping mechanism. People with personality disorders may turn to substances or behaviors as a way to self-medicate or manage their distress. The brain, already altered by trauma, is further changed by the addictive substances or behaviors, reinforcing the cycle of addiction. In essence, childhood trauma can set off a chain of events leading to personality disorders and addiction. But remember, this isn't a death sentence. Understanding the science behind the link is the first step towards healing and recovery. The human brain is remarkably resilient, and with the right support and treatment, individuals can learn healthier ways to cope and lead fulfilling lives. Understanding the link between childhood trauma, personality disorders, and addiction is the first step to breaking the cycle. In our journey toward healing, it is pertinent to know that early intervention and treatment can help break this cycle. It's like a chain reaction. Address one link and the whole chain weakens. The key here is to seek help as soon as we recognize the signs. Let's talk about therapies. Cognitive behavioral therapy, or CBT, is a powerful tool that assists individuals to understand and change thought patterns that lead to harmful actions or feelings. It's like rerouting a busy highway of negative thoughts into a peaceful lane of positive perspectives. On the other hand, dialectical behavior therapy, known as DBT, is a type of cognitive behavioral therapy. Its main goals are to teach people how to live in the moment, develop healthy ways to cope with stress, regulate emotions, and improve relationships with others. It's like learning to surf the waves of life rather than being overwhelmed by them. Lastly, we have trauma-focused cognitive behavioral therapy. This is a specific type of CBT that helps individuals cope with their trauma. This therapy focuses on understanding how one's past experiences influence current behaviors. It's like turning the rearview mirror of past traumas into a windshield of healthier future actions. With the right support and treatment, it's possible to overcome childhood trauma, manage personality disorders, and recover from addiction. So let's take that first step together towards breaking the cycle and embarking on a journey of healing. The link between childhood trauma, personality disorders, and addiction is complex, but not insurmountable. As we've explored, understanding the science behind these links can lead to early intervention and effective treatment. It's crucial to remember that with the right support and resources, breaking the cycle is within reach. This conversation doesn't end here. Let's continue to learn, share, and support those impacted. If you found this video informative, do click like, share it with your friends, and subscribe to our channel for more insightful content.